Up next is a panel called Lessons from Patient Advocacy Experts. We've gathered four of the most experienced patient advocates in the world and asked them to reflect on their successes, both in biosimilar policy and elsewhere, to give you the benefit of their combined decades of experience. They'll give you tips on how to collaborate with allies, identify champions, make clear policy asks, build long-term relationships with policymakers, stay informed, and keep your members engaged. We feel that the lessons that these experts share in this panel are so important that we summarized them into a document called 7 Lessons from Patient Advocacy Experts. And you can find this in the Biosimilars Patient Advocacy Toolkit. The recommendations and best practices they identify will not only help make you a more effective advocate for patient-friendly biosimilars policies, but they can also be applied to any work that you do in the patient advocacy field.
This panel is entitled Lessons from Patient Advocacy Experts. So we know that in order for the patient voice to be included in policy matters, that patients and patient advocates must get involved in these conversations with regulators and with policymakers. We have gathered together some of the leading patient advocates around the globe who are each going to talk about advocacy success stories and what they learned as advocates in doing these movements and things that you can take away from it. I'm really proud to introduce our panelists today. We have Gail Atara, who is the CEO of the GI Society in Canada, where it's the morning. So thank you, Gail, for joining us early in the morning. And we have Hussein Jaffrey, who is the Executive Director of the World Patients Alliance, a global organization of about 350 patient groups across all disease areas, representing, I believe, up to 111 countries now. Hussein is also the Secretary General of Alzheimer's Pakistan, and it's late at night for Hussein, so thank you for joining us late at night. Zorana is the CEO of Digestive Cancers Europe, formerly Europa Colon. She has been with that organization for many years. Her background is in molecular biology, but she has been in the nonprofit arena for more than a decade, and she's going to share the European experience. And I am Andrew Spiegel, the Executive Director of the Global Colon Cancer Association, and I've been involved in the biosimilar space all the way back when I was doing US advocacy only back in 2010, when the US FDA announced that a pathway was going to be created for these new products to come onto the market, these biosimilar products. Tell us some advocacy success stories that you've had, whether in the biosimilars arena or not, and what is your take on this whole thing that's happening up in Canada?
Thanks so much, Andrew. So I'm the president and CEO of the Gastrointestinal Society. I've been doing that now for 26 years. So during that time, we've had a lot of experiences of bad policy across all kinds of things. We in our organization cover everything, as I always say, from gum to bum. And so there's a lot that can go wrong in your digestive tract. When the whole biosimilar issue was rising, we called them in Canada subsequent entry biologics. That was the name that we were using for them up here. Excuse me. And when that happened, there was just no information for patients about what these were. So people tried to say they were generics, but then no, they're not generics, they're biosimilars. Well, what does that mean? So I think the first barrier that we had here was education. We had to educate our population and our individuals. But one of the things that I did is I brought together a whole bunch of other patient advocates from across therapeutic areas. So in all these other disease areas that we got together, and we formed what we called the Biosimilars Working Group, a very simple name, but we were able, and ASBM is part of that. And, we're trying to just convey educational material was our first thing. So we created video and we did all kinds of things. But I think the biggest thing we had is we had a big ask for government. The first province that came up with a biosimilar policy, or was even thinking of a biosimilars policy, was British Columbia, the province where I live. And so it was a big deal to me. I knew the government leaders quite well. I've worked with them over years successfully on many things, but this was a really big deal. It was really hard. They were absolutely stonewalling in terms of what they would do. So we went to them and said, well, why not let biosimilars come onto the market at the same price as the set one price and have biosimilars and originator biologics all come in at the same price. And so that a patient wouldn't have to switch. That would be the least impact on patients. And that's what we pitched, but they wouldn't have anything to do with it. The bottom line is the policy that they came up with was really hard, really harsh. Everyone had to switch no matter what. And so we have 10 provinces and 3 territories in Canada. And so our work in British Columbia was brutal. But then we have had some other success stories. So for example, this last year, Quebec was considering a policy change, and we pitched to them some compromises. So we had found that a lot of people were able to switch successfully to a biosimilar in BC, it turned out. There were some horror stories, though, that we wanted to prevent those horror stories from happening in Quebec. And so we pitched, we set a bunch of criteria that we thought would be really appropriate, patient-friendly criteria. And we pitched those to Quebec, and Quebec adopted every one of them. So again, I think that, there were learnings there as to say, you first want to go for your blue sky ask for sure. But then the other thing is to really think it through. What are the minimal things that we really, really need to have? And so I think that really was a success story because, and then we still have other jurisdictions who have not come up with a policy yet. We're still slowly creeping across the country in terms of what some jurisdictions are doing and others aren't. And they're all different forms of policies. And it's so fractured. So it's uncomfortable for a person to move because you just don't know what the other province is going to give you. The key thing, I think, was that we had to maintain really good, positive relationships with government individuals, bureaucrats and politicians, to be respectful and kind and understanding about the situation, but also conveying the atrocities that were happening in the government for patients. They were just really not experiencing a lot of good things. They were, flaring up. They were back in hospital. They were having bad reactions. So there were a lot of issues that were going on. And, patients were calling us constantly and telling us what the problems were. So bottom line is we were representing patients as best as we could, going to the authorities, and some authorities would listen and some would not. I think the key thing is that, you have to keep pushing, bring other people together, be kind, be friendly, but be firm. So that's my experience.
Did you also have to bring data? And if so, did you create that? Where did you get the data?
Yeah,
anecdotal stories are one thing. Our hotlines are getting inundated with things, but what kind of data did you have?
We did a lot of surveys. We talked a lot. We had in one case, we had during a short period of time, we had 100 people who called us saying that they were having trouble with a policy change. That's a lot for a patient group to handle that many calls just on that one issue of patients having problems switching. So yeah, we did bring that to the government. Unfortunately, the BC government, British Columbia government, were just saying, oh, that's anecdotal. And so it was really tough, but we did surveys as well, which I have covered in my talk before this panel. We did do a lot of asking people what they were going through, really getting that ground level. What are you going through? And we need to know.
One of the things that we did here in the United States was the FDA created basically 2 classes of biosimilars. And you've already heard from other speakers, hopefully, and know all about the difference between a regular biosimilar and the higher level of biosimilar that they call an interchangeable biosimilar. And the higher level of scrutiny by the FDA on interchangeable biologics also came with the fact that pharmacists would be allowed to substitute the biosimilar for a doctor who prescribed the originator biologic. So what does that mean? So if you have an infection and a doctor prescribes you an antibiotic, you go to the pharmacy, and even though the doctor may have written the brand name of the antibiotic, the pharmacists in every state are authorized to substitute a generic drug for that chemical drug that was prescribed for you. As the FDA created this heightened level of approval, these interchangeable biosimilars, they gave pharmacists the right to substitute a biosimilar for a prescription for original biologic drug. But no states had laws on the books in the United States for these. There's generic state laws for pharmacies and pharmacy laws in every state that control what the pharmacists can and cannot do, but there were no laws for biosimilars. So a group of us, patient advocates, all got together and we formed a coalition, and we started moving on this issue, including the Alliance for Safe Biologic Medicines, who is a co-sponsor of this event. And as part of the Alliance for Safe Biologic Medicines, this small, very small but mighty group of advocates, several of which have been involved in this program, got together and actually went state by state advocating for new pharmacy laws to be passed that would allow biosimilars to be substituted, but to be substituted in a way that was patient friendly. And we came up with criteria for what that meant. And we got buy-in from all other stakeholders on our side. And let me tell you, this was a fierce multi-year battle, because the stakeholders on the other side of the arena, the payers for the most part, the pharmacy benefit managers, the large pharmacy chains, vigorously opposed the patient-friendly laws that we advocated to be passed state by state. And I'm not going to get into all the details of what those laws were and what the opposition felt, because it's a very long story that could be a webinar in itself. But I'm pleased to report to you now that as of last year, all 50 states in the United States have adopted biosimilar substitution laws, and all of them adopted the language that we had asked for. And it took probably 5 years of work and trips to almost every state to get those legislatures to individually pass these laws that help protect patients when pharmacists will be able to substitute these biosimilar drugs. So that is my success story on how we did it. And we did it by simply calling in all other stakeholders who had similar positions that we did, who were concerned with these biosimilar laws being passed with patient-friendly language in it. One that was vigorously opposed by the other side was simply that if a pharmacist switches your drug from something that was prescribed by the doctor to a biosimilar drug, that your doctor be notified of the switch. We simply wanted the physician to know what drug you were taking, exactly what drug it was, who made the drug, and that a switch had taken place. We wanted the medical record to be accurate so that if there was something that went wrong, they would be able to directly attribute it to the exact drug the patient was taking. And you wouldn't imagine the opposition that came to that against that specific issue of physician notification. But we won that, and we won that because we were right. We had a group of patient advocates who made the case for, we want our physicians notified exactly of exactly what medicine we're taking. We want our physicians notified of exactly what medicine we're taking. And legislatures bought into that, and all of these laws were passed with our patient-friendly approved languages. Why don't we head all the way over the sea to Zorana? And Zorana, why don't you share with us a little bit about your organization and then about your experience with advocacy success?
Thank you, Andrew. So Digestive Cancers Europe is the organization that grew from Europa Colon. We used to be an organization dedicated to colorectal cancer since 2004. And then in 2018, we embraced all digestive cancers and re-registered in Brussels. And currently we have close to 40 national member organizations across WH region Europe. So I think that our policy activities and advocacy activities mainly are at the European level, while at the EU level, while we support our member activities at their national, and sometimes the policies differ. So I think that the example that I could tell today is somewhat similar to what Gail presented and also what you said earlier. And I could also mention the example on biosimilars. So several years ago, we organized a focus group with colorectal cancer patients. That was just a little bit before the biosimilars for colorectal cancer came into market at Europe, and we gathered 8 patients in the room together with 3 experts, and just wanted to see how they feel about biosimilars and how, what are their questions, what currently they knew about them, and whether they have heard something. And for me, it was very interesting to witness something, what happened in the room, that those patients that felt fear when biosimilars when mentioned, through the educational process over the 3 or 4 hours, that was how long the workshop was. When they saw the data, they also, we do have European Medicines Agency, who we feel is doing really good job. And then they felt completely different. So based on this focus group, we have developed our position statement on biosimilars, which is available on our website. But then we said, okay, so we need to do something at the wider level to educate all the patients that are receiving biosimilars across Europe, but also we need to empower clinicians in order for them to be able to communicate well with patients, because we feel that patients should be informed on what treatment they are receiving. If there is switching to happen, that this should be made jointly, the decision among the healthcare provider and the patient. And also, we felt that there are many good practices across Europe, in some European countries, where savings from biosimilars are used in a transparent way and used locally, benefiting the patients, the clinicians, the nurses, and some of the examples are hiring additional staff or improving facilities where patients are treated. And I think, this makes sense, because if the savings are used somewhere else, biosimilars bring savings into the healthcare system for the patient, for the clinician, that doesn't mean anything. So we gathered a multi-stakeholder group comprising of patients, patient advocates, experts, health economic experts, clinicians, pharmacologists, pharmacists. So together with this multi-stakeholder working group, we designed a set of materials to educate patient healthcare providers and all those that are involved in patient treatment. But then we said, okay, we need to do something at the European level in order to have this inside the policies. And this was the time when the new European pharmaceutical strategy was developed. So we set up meetings with relevant policymakers to explain, why is this relevant to us, and how policies can change to ensure that patients are treated in the best possible way, and also savings are used in the best possible way. And after many individual meetings with policymakers, we also organized one big policy event, after which we developed our call to action, with our specific asks on how education should be, how we could share best practices across Europe. So we developed those asks, and after this meeting, and then again, additional meetings with policymakers. And I think the key here is to establish a long-lasting relationship, to be the reliable partner, the trusted partner. And I think that we have managed to do this. We have managed to put several of our asks in this European pharmaceutical strategy, which is still not yet finalized. So I am eager to see the final outcome. So on Digestive Cancers Europe, we have an education section of our website. And then under this education, everything around biosimilars is in one place.
Throughout this two-day event, we have heard a lot about how Europe has done it right with biosimilars. One of the things in Europe is that they have always given the doctor the power to determine which biologic or biosimilar a patient's going to get. Is that kind of what your understanding is, being in Europe?
Well, yes, obviously Europe is huge and there are many different practices, not in all countries.
Right.
But I think overall we feel it's important that clinicians have that power to decide what's best for their patient jointly with the patient. So, discuss if there needs to be the treatment needs to be switched, explain to the patient what does it really mean for their treatment and care, because we do not want the nocebo effect to happen.
Right. Right. Well, thank you for the hard work you're doing for patients and for your story and telling us about that work. So Hussein, you have been in the patient advocacy arena for decades. You are a WHO patient for patient safety champion. I believe you're the vice president of the Patient for Patient Safety Champion division of the WHO. You are executive director, co-founder, board member of the World Patients Alliance, which is now the world's largest patient organization. Tell us a little bit about some of the successes that you've seen in as an international organization that not only has international reach to policymakers and things of that nature, but also has grassroots abilities.
Yeah, thanks, Andy, for a kind introduction. So we need to have very realistic goals. We may take stepwise approach, and we need to have our demands and priorities. That are you need to try to have the demands which are in line with the priorities of the government. So for example, if you're running a campaign and on patient safety, for example, that's what you just mentioned. So we can maybe convince the government that moving towards patient safety or working towards patient safety basically reduces the cost. So you must be able to provide a solution to the policymakers, give them a clear direction on what you want, rather than just asking for improvement in patient safety. So if you could ask precisely what actions you want from the government, or what examples of infection control, for example, in hospitals, you are looking for. So basically, as as mentioned earlier on, that we need to have data, we need to have facts, and policymakers need those facts. Often these are not available when we start our advocacy campaigns. And then we should work towards partnership. We can't do things alone. We need to have other partners working with us, as mentioned earlier with the earlier speakers, that how they partners with other organizations. Then we can also work towards having spokespersons or champions, championing our cause. And we need to find people. They might be your allies in the government. They might be civil servants. They might be leading healthcare providers, or they might be public heroes, people, some people, somebody who people recognize, and when they speak something, people would listen to this. We need to have facts. We need to have a clear ask. We need to partner with the other organization. We need to have champions, and finally, we need to be focused. So advocacy is an ongoing sort of a process. It's not just one of an activity, and you've done this activity and that's done. So it's not like that. Now coming to one of our very recent activity that we have conducted through World Patients Alliance is the World Patient Safety Day, which basically has been celebrated every year on 17th of September. There are more than 2.6 million deaths annually just because of patient safety. 1 in 10 patients get harmed while seeking care in higher income countries, and if you compare it with low income countries, that's many times higher. So there's many facts already available. So we were lucky in that sort of sense. So we decided to select this issue and ran a campaign all over the world. So we basically decided to even also invest into this campaign. We took out a call for seeking grants and bursaries. So our organizations basically applied for those grants. We provided those grants, and so they came up with a number of activities that they wanted to organize in the community to promote patient safety. So we had many organizations applying for it. We provided, I think, 4 or 5 bursaries per continent. So we have 5 continents. So we provided bursaries of about 25, 30 different organizations and organizations also at different levels of development, some at grassroots level and some at a higher level. And I'm very pleased to let you know that we organized the largest, global World Patient Safety Day campaign in the world. We organized more than 800 global events all over the world. And it is unheard of, the sort of numbers that we have come up with. And the reason was that we involved the organizations who are actually working with the patients at the grassroots level. And the success of this whole program was that these organizations not only were able to organize these events, but they were able to make partnerships with other organizations.
That's an amazing success story. How did you make it easy for your members to engage so that you were able to host over 800 events? What tools did you create, if any, that helped the members hold local events, even though you're a global organization?
Yeah, I think one of the main success of our organization, being able to, have this big, large organization with so many members, is that we are constantly in contact with our members. We're constantly doing surveys, we're constantly doing activities. So they're constant sort of an correspondence, communication going on between us. But then once we had this campaign, we actually designed the whole campaign for them. So we didn't just put everything on them. We designed the posters, we designed the sort of theme, we designed the literature that they require, we designed the presentation that they needed. So we designed everything, and I think that was perhaps one of the successes, that we didn't put everything on them. We facilitated them to run a successful campaign.
Zarana, do you have any final advice for organizations on how they can have a more active voice in policy issues?
Then in our case, when it comes to, for example, biosimilars or colorectal cancer screening, our strategy was to reach out to policymakers. But then again, when you meet them, you need to be brief, you need to stick to your points, not want to cover everything in one meeting. Also, you need to be positive, to be constructive, focus on your policy asks. And then, I think it's important that you do follow-up activities in order to build the long-term relationship with, policymakers. So when it comes to working with member organizations, I think that Hussein is really right, that it is about constant communication, about appreciation, about understanding their needs, and also about understanding what would be the best way to support them.
Mm-hmm. Great advice. Great advice. And Gail, what final piece of advice you have and where people can go to learn more?
So we have a lot of information on our website. So it's badgut.org. Easy to remember. You got a bad gut, right? And I just like to also, talk about, what Hussein is doing. And we are a member of the World Patients Alliance. I think that it's important to join. We're not incredibly active, but I think it's important to show support for each other. And I really thank you, Andy, for this whole session and for what we're doing here today, because I'm hoping in some small way we'll be able to help someone else.
Yeah. Well, it's been a very small group of us advocates who have been in this space for the last decade, and we need more. We need more people to get involved. And I can't thank all of you enough. This has been a fantastic panel.
Thank you again to our experienced advocates for their time and dedication to the patient community.